Tooth loss is a common global phenomenon. In Germany alone, about 13 million teeth are lost every year. For example, by accident, illness, or insufficient oral hygiene. The importance of teeth often only becomes apparent when they are missing.
What possibilities does modern dentistry offer to treat tooth loss?
When one or more teeth are missing, two proven treatment methods are available: conventional bridges or implant-supported tooth replacement.
Let's have a look at conventional bridges first. To fix a conventional bridge, healthy neighboring teeth need to be ground down and are thus damaged. A conventional bridge is supported by the ground down adjacent teeth. The tooth replacement is not directly attached to the jawbone, it rests on the gums.
The chewing pressure is transmitted onto the adjacent teeth and transferred through their roots into the jawbone. This results in an additional strain on the adjacent ground teeth. With a conventional bridge, the jawbone is no longer naturally loaded. However, bone is a vital structure. This means that it resorbs slowly over time in the absence of chewing pressure. It atrophies.
This also has an effect on the gums. They reduce as well. As a result, the important support function of the tooth-jaw system is affected and out of balance.
Let's consider the alternative treatment method, the dental implant. The implant replaces the root of the missing tooth and functions like a natural tooth. Just like a natural tooth, the chewing pressure is evenly distributed by the implant to the entire jawbone.
This reduces the risk that the bone and the gum tissue recedes.
The implant restores the natural chewing function. The important support function for lips and cheeks is preserved. This also works if several teeth are missing, such as with interdental gaps or shortened dental arches.
For edentulous patients, there are multiple possibilities to anchor removable dentures safely on implants. For example, by locators, retentive anchors, double crowns, or bars.
The screw-retained comfort restoration is also a good option.
How does an implant placement procedure work?
Initially, the gum is opened. The bone is prepared using special medical drills. The implant is inserted into the jaw and provided with a healing cap.
Then the gum is closed again. During the healing process, it is important that there is no load on the implant and that the implant has time to integrate into the bone.
The trabecula of the jawbone grow onto the implant and enclose it progressively. The result is a solid and secure connection between the implant and jawbone. The fact that the bone grows onto the implant is a natural process, the so-called osseointegration.
For a most natural-looking outcome, the gum tissue is shaped so that it can be suitably adapted to the planned artificial tooth, the crown. An intermediate component, also called abutment, connects the crown to the implant.
Thus, the new tooth blends naturally into the patient's natural teeth. An implant restoration is a long-term investment in health and quality of life. With regard to function and aesthetics, Implant restorations deliver results closest to the natural tooth.
Talk to your dentist to find the best solution for your individual situation.